Good morning, everybody, and welcome to this live stream. Today, we're going to do a quick recap of what we covered over the last 3 weeks. Okay, um, that will be the muscles of the knee, the muscles of the lower back, and the muscles of the neck area. All right. Okay, so we'll start with the knee. All right. So, um, like I said in the live stream, so basically your thigh muscles on the front have four muscles, but three that is important. It's the vastus group, the vastus medialis, the vastus intermedius, and the vastus lateralis. Lateralis this side, medialis this side. Okay, that's intermedius. Okay, running over that will be the rectus femoris, or, which helps in lifting your knee, flexing your hip. All right. At the back, you have your hamstring group, as it's more commonly known, which consists of your semitendinosus, your semimembranosus, and your biceps femoris. All right, that runs all the way up. All right. Okay, these muscles help to straighten and bend or flexion, extend your knee. All right. Now, just coming back to the knee, the bones and ligaments. So you got your femur, which is your thigh bone, and that is connected to your shin bone or your tibia. All right. You got your kneecap here. Over it runs your patellar ligament. All right. On the side, you got your medial in the inside here, and your lateral on the outside there, collateral ligaments. All right. I made the mistake of saying cruciate ligaments last time, so I do apologize for that. All right. And going in the back, you have your anterior cruciate ligament. This one here in the front, and the one crossing here at the back as your posterior cruciate ligaments. All these two, and the lateral and collateral, the lateral medial collateral ligaments, all helps in stabilizing the knee joint. All right. Now, just a quick one. What happens when you injure the knee? We know the body always finds a way to overcompensate, so you will have atrophy or muscle wastage of the vastus medialis, and then you will have the vastus lateralis will tighten up. Okay, so it's good to strengthen medially and try and release or lengthen laterally. Okay, on the outside, medially inside, lateral outside. All right, so that covers the knee. We will come back to the exercises at the end that we prescribed you for the knee. All right, moving on to the lower back. Okay, so I'll just turn my model this way so you can see the back here. So just a quick one on the spine. So you've got your cervical vertebra, which is your neck. You've got your thoracic area, which is your thorax or chest area. And then you've got your lumbar vertebrae. All right. You also have sacral vertebrae, which are fused. All right. Also consisting of five. All right. 5 lumbar, 12 thoracic, 7 cervical. Okay. Going back to lumbar, L1 to 5. All right. The muscle surrounding your back, specifically your lower back, will be the two ones that we discussed that are very important. Was the quadratus lumborum, which acts as stabilizer. Remember, as mentioned before, your back has got 3 layers of muscles. All right, you've got your superficial layer on the outside that you can see on your lower back, and then you got your intermediate, and you got your deep layer muscles. So erector spinae will be located relatively deep, but can be seen. Your quadratus lumborum are intermediate muscles, and then you get your really deep layer ones, such as your multifidus. All right. Like I mentioned with the erector spinae last time, is your lumbar erector spinae, so the muscles of the lower abs. Because remember, your rector spinae runs all the way down from the top to the bottom. All right, it is the one that makes your vertebrae move independently. All right, so your lumbar erector spinae, if it is one of the major culprits of LBP or lower back pain or mechanical lower back pain, as we call it, specifically if they are deconditioned or if they are atrophying. Okay, so just an important note to remember on the muscles of the lumbar spine. Now, in your thoracic spine or your upper back or the areas of the thorax, you have your mid-trapezius muscles, and you obviously by the neck have your upper trapezius too, but the mid-trapezius is the one we discussed, and then you have your rhomboid muscles, and those help and enable you to open up your chest or pull your shoulder blades together, basically. All right. There is also the muscles of the levator scapula. All right, which basically does what the name says. Levator scapula meaning shoulder blade, levator meaning elevate, so lift it up, so it helps you shrug your shoulders. Okay, if you don't understand, shrug your shoulders. And then obviously we touched really quickly on the muscles of the posterior deltoid or shoulder area, which includes the rotator cuff group, so the sits group, your supraspinatus, infraspinatus, teres minor, and subscapularis. All right, and those are actually, like I mentioned last time, very more important for a independent video on the whole circumference or the whole shoulder area. All right, or shoulder girdle. All right, so we'll leave that aside, but that's where those are muscles that you can see if you look at your back. All right. So yes, so those were the muscles that we covered regarding the back. And now to move on to the neck and the muscles of the neck. So the cervical area, again, I mentioned last time, the cervical vertebrae starts with C1, which is your atlas, and then you got your C2, which is your axis. So here's your atlas, here's your axis. All right, and you got C3, 4, 5, all the way down to 7. C7 is the most prominent one. So if you bring your chin to your chest, that's the knobby one that sticks out here. So for clinicians and therapists, that's a good landmark to know on the back of the neck. All right, very important. If the C7 vertebra is very prominent when you have someone on prone or on their stomach, then obviously you know they have a certain degree of kyphosis, like rounded shoulders or that forward-jutted head posture of that you get among office workers and people who spend a lot of time in front of their desktops or their laptops. All right, or on their phones. Then now the muscles of the neck. Okay, so you've got your sternocleidomastoid. I said that's very important. It enables the neck to side flex, bend sideways, and rotate and extend. Things like those. Okay, very important muscle, especially for therapists, massage therapists, to loosen up, because as soon as you loosen up, it frees up a lot of things that's going on in the neck, especially if there is trapped nerves involved. And people have trouble grinding their teeth, things like that. All right, so for massage therapists, very important muscle to know. Then we covered the muscles of the upper, mid, and lower scalenes. Okay, the superior, medial, and inferior scalenes. Okay, those are involved in respiratory work while you're breathing. And as I mentioned, if someone is breathing heavily, or they have trouble breathing, or they breathe very superficially, they're not using the diaphragm well enough, then accessory muscles will overcompensate. Okay, and the muscles of the scalenes will tighten up, and like I mentioned last time, a tight muscle is not necessarily a toned muscle, it can be a weak muscle. All right. And then also we discussed the hyoid group, especially you get your supra-hyoid muscles and you get your infra-hyoid muscles. Supra meaning top, infra meaning bottom. And just to count, you got the ulmohyoid, you got the mylohyoid, you've got your sternohyoid muscles, and those are all involved in mastication or chewing, swallowing, things like that. All right, so those were the important muscles of the neck that we covered briefly as well. Now, okay, enough of the anatomy. I'm just going to put the models back here so we got some space freed up here and I don't knock them over because they are easily knocked over. We're going to go through some of the exercises that we discussed. Now, getting back to the knee, what we mentioned last time is you need to strengthen your knees, especially after injury, especially if you're looking at therapeutic exercises. You want to keep it simple in the beginning, especially if you can't load bear or put weight on the limb because of pain or swelling or just general weakness. So you got to strengthen the muscles of the medial area of the inside of the knee and of the lateral area of the outside of the knee, the top, okay, so your thigh muscles, and then obviously the bottom of the thigh or the back of the thigh, which is your hamstring group. Okay, now the best way, like we discussed last time, is to strengthen your abductors, which is your glute med muscle. Okay, I know it's located up here and that wasn't discussed as part of the knee anatomy, but it is a very muscle to strengthen, very important muscle to strengthen, excuse me, because it helps to stabilize your hip. We can take a lot of pressure off the knee if your knee joint is injured. Okay, so you can just, these you can do in bed, like discussed last time. You can lie on your side, all right, with your head on a pillow or using your arm as a pillow, and you just lift the leg up and down like this. All right, you want to make sure that the whole leg area is slightly an extension. Okay, so you don't want to have it too far forward because you will recruit the wrong muscles, especially the TFL or tensor fasciae latae up here, which can cramp up and stiffen up very quickly, and you're not really targeting the right group that's going to help. Okay, so you got your lateral leg lifts here. All right, then also you had your medial leg lifts. All right, and those were done like this. Those work the adductor groups and the muscles of the adductor group, like the gracilis, that runs all the way down next to the vastus medialis here. Okay, so those are important to strengthen. Now, the posterior muscles, I did cover the bridge because that's a good one, but we did mention that especially people with knee injuries, you know, the hamstring muscles, there's always a chance of it cramping up. So, and another way discussed was to do it like this. So prone on your belly and then lifting one leg up while keeping both hip bones intact with the floor and your ribs down, obviously, so you don't overcompensate with your lower back. So watch for that. Okay, so you want to feel the muscles of the posterior activating. All right, and you can also do it with a bent knee, lifting up there. All right, so those were the ones that were covered surrounding the knee joint. Oh, lastly, we also did a seated one for the top of the thigh, where you can either roll down a towel or use some sort of a couch pillow or something under the knee, and you can bend and straighten the knee joint, and that will help to also to activate that VMO muscle or that vastus medialis, which, as I mentioned, can atrophy during knee injuries. Okay, so very important to keep that one strong, especially when it comes to, for those for therapists and clinicians out there, when it comes to bringing your patient back to load bearing things and stuff. Okay, so those are the ones that can be done lying down, seated, and lying on your side. Okay. lying on your front sides and seated. All right, for the knee joint specifically. All right, now for the lower back. All right, we went through getting that transverse abdominis strong because it is a stabilizer for the lower back. So the easiest one, like I told everyone last time, was to root your lower back into the surface below you, whether that is a bed with a firm mattress. Okay, if the bed doesn't have a firm mattress, it is better to do these on the floor. All right, is to lift one leg up, placing your forefinger and your middle finger here on your abdomen, on the soft part, just above your where the hip crease is. Lifting one leg up and then joining with the other leg, taking one leg down, keeping the opposite leg very, very still when you do that, and then bringing the other leg down. Okay. Um, we also looked at advanced ones, doing contralateral movement like the dead bug. It's really, really good exercise to get the transverse as well as your rectus abdominis or your actual six pack going to protect your back. All right. And now to strengthen the back, at the back posterior, no better exercise than the bridge. All right, everyone's go-to. Everyone should be bridging. All right, especially to keep those QL muscles, those quadratus lumborum muscles that we discussed, and obviously the lumbar erector spinae to keep those strong, as well as the multifidus. Everyone should bridge either with their feet flexed like mine. I like doing it with my feet flexed because it really brings the glutes into play. Or you can do it flat. All right, there will be a little bit more hamstring activation then. All right, and for those who feel brave, can hold it up isometrically under tension, and then hold one leg up, hold it for time, and then the other leg up. All right. Okay. Then we also looked at the rotators of the back. All right. So the knee side to side one is a favorite or go-to exercise for lower back pain as you're starting out. After you injured your back. So best one, like I said last time, is gluing the knees together, dropping to one side, and then dragging it back to center, and then alternating, if you please. Again, don't let the knees slide off each other. So one glute and one side of your hip will lift up as well as one foot, okay? An easier version is to cross the leg over, then you get the internal hip rotation too, which is really great in freeing up the lower back. And then just doing one side first and then switching over to the other side. Remember, the leg that's on top is the side you are going to. So you'll feel a lot of things going on here. Okay, so that was rotation. So we had extension and we had flexion and we had rotation of the hip and spine, lower back and spine, and lower back and hip area, pardon me. All right, and then now for side flexion, last time we discussed kneeling up like so, and then sliding one hand down next to the seam of your trousers or shorts. You can do one side first and then the other, or you can alternate, all right, to free up some space here, because sometimes if things are very tight here, especially those QL muscles, those quadratus lumborum muscles, you will have trouble side flexing, and that could put a lot of pressure on your lower back. Okay, so to recap, that was the lower back muscles, lower back exercises to strengthen the lower back covered, the basic ones, the bare bone basics. Those are the ones we discussed in the live stream when we did the lower back. Now, for the neck. So, as I showed you last week, the best way to strengthen the neck is to lie on your back. And before we start with the exercises, again, if you have an existing neck injury, before you embark on these on your own, especially with the neck, go get yourself checked out and make sure, show the clinician you're working with the neck exercise and make sure that those are the right ones for you, because there's just a lot of things going on. Because up here is your mainframe, all right? There's a lot of nerves running here. And if you have issues here, it can mess with your blood pressure and a lot of things. So please get yourself checked out first. before you start any exercise program. Okay, but if you are relatively healthy and you don't have any neck issues at the moment, you can give these a try. All right, so you can knock the head, lift up. All right, and then you're gonna do your yeses. Okay, that is for flexing and extending the neck. Okay, then there's also your nose, side to side, and then there's also your maybes. As you can see with my palms, when I'm doing anything that I'm lying on my back, I always keep my palms up because it places my shoulder in external rotation, which is good because our shoulder most of the day will be internally rotated, especially when you slouch in front of the computer. All right, so flexion, extension, rotation, side flexion. Okay, yeses, nos, and maybes. Always reach through the fingertips. All right, and then we quickly touch on some advanced one, especially for people out there that do contact sports. You can strengthen this by lying on an elevation, all right, or on the bed, and you can move to the side of the elevation or bed, and so your neck is hovering, so you got extra range for gravity. All right, when you do these exercises, that's one way of making it harder. Okay, and we also discussed the use of things like neck harnesses and neck bridging and things like that. Works for some people, might not work for other people. Me, I'm not a fan of the neck harness with the weight on it because your weight is only be the weight only pulls your head down. All right, so I prefer more the new modern version with the brace that you put on your neck with the elastic bands where you turn your neck and it provides resistance. It's a much better way, safer way of exercising the neck without putting compression on the vertebral discs in between your vertebrae. Okay, so those were the knee, lower back, and neck exercises that were covered in um, our past live streams. Um, and then obviously we went over the anatomy as well. If there's any questions, post them to the site, or if there is any suggestions for future live streams, please let us know what you would like to enjoy and what would you like us to cover as well. All right. Um, there will be upcoming webinars in the next coming weeks, which you can join, where we will be discussing knee pain, back pain, and neck pain again. All right. And please don't forget to like this live stream and to subscribe to our social media out there. I hope this was a good recap and that I covered most of it. I think I covered mostly everything we discussed. And yes, go try those exercises out, especially the lower back and knee ones. You can give a try. They are very, very safe. Be careful with the neck ones. Get yourself cleared first before you embark on that. If you are injured currently, always better go get a clinician's advice. You can show them the exercises on your mobile phone so they can have a look and see if those ones will work for you. Other than that, if there's not any questions, I will see you on the next live stream, and I hope you are all having a good week. Bye now.